cervical lamina supine. To start off with cervical lamina supine, you're going to make sure that you find your landmarks. That's going to be your spinous processes, and your outside border is going to be the SCM. You should not go past the SCM or the spinous processes. The routine is utilized for people suffering from whiplash, from torticollis or shortening of the SCM. It's also used for headaches, cluster headaches, which tend to develop in the back of the head, migraines, and as you're working through this area, be conscientious of, again, the jugular vein, the carotid artery, the sharp points of the spinous processes, and the lateral points of the spinous processes on the transverse side. And then also make sure that you're conscientious about hyperrotation of the head. So if the client is already experiencing neck pain or any of the other conditions that I just mentioned, you want to make sure that you're listening to them, or if you're checking to see if they're having any kind of spasms when you have them in head rotation. So extreme head rotation, the spinous and transverse processes should all be considered when you're utilizing this routine. So the routine starts off with the head in the supine position with the nose facing up to the ceiling. The hand cradles underneath the head with it in a slight tilt. And your landmark is to find the occiput, or the base of the bone in the back of the head is the occiput. Make sure you locate the spinous processes and step towards the transverse laterally. Okay, don't step medially or else you'll be poking the spinous process. So when you're in the actual laminar groove and you have your landmark, the head is going straight up to the ceiling, and you're just doing a gentle glide down from the occiput to C7. Make sure that your body positioning is comfortable. Make sure that your shoulders are low and that you're not hiked up, hunched up. Make sure that your face isn't over top of your client too closely. All right? And step 2 is a slight rotation, and continue that same glide from occiput down to C7. Step 3, fully rotate the head away and find your next landmark and just repeat. You can achieve this with either 1 digit or 3, whatever gives you the most comfort, as long as you avoid your landmark. All right, so again, cervical lamina supine.